Welcome to yet another installment of Kathy and Andrew's update. As you can see, well decked out today. Some of you are probably saying, come on, would you stop using this as a platform to promote the Ottawa Senators? And that might be partially true, but today is hashtag Jersey Day for Canada. And I know that because I saw a tweet from the Premier in his Toronto Maple Leafs jersey. So I am just going to wear this. If anybody else wants to borrow this for the rest of the evening, just let me know. It's available. It's in my office. So anyways, that said, thank you again. As we start every video, just acknowledging all the great work that's going on within the organization, across the community. We're starting to see some positive signs with respect to the economy getting back open again. The demand, as we know, on our healthcare system has not materialized to the degree that we thought it might. We continue to work closely with long-term care. Obviously, a major focus of ours is supporting as much as we can into the congregate settings environments. We've redeployed staff into Greenwood, into Braemar, into Blue Water, and also into Hillside. So kudos to all who are stepping up in that way. It's also, again, if you remember last video, we talked about the various weeks and days that are coming along, and this is Mental Health Week, Mental Health Awareness Week. And I just wanted to focus a little bit on that because it's so important that we look after our own mental health in today's environment. I mean, it's important all the time. When we're in a very different world, when we're often physically isolated at home, we're in PPE at work, and we've lost a lot of that personal contact. It really is important to remember the key role that socializing plays in our life and with our well-being. We are pushing, and you've seen a survey that came out this week on mental health. We're looking at introducing a peer support program. We've had some great feedback already on the survey, and I would urge those who haven't yet done it to do it. There is going to be a draw for a $100 gift certificate at a local garden center. And with the snow this weekend, who's not thinking of gardening? So please do the survey. One of the tags that we're focusing on is hashtag Get Real. And that's being promoted because I'm sure you've all had experiences when you talk to people, how you doing? I'm fine. And then we move on. And a lot of people who say I'm fine really are not. And so it's an important consideration when we're engaging with people and really trying to talk, to communicate, and deal with some of the challenges that we're focusing. We have a great EAP program through Green Shields, and again, therapies are available through that. So I would urge people who feel the need to talk, if they have not got a social network around them, to take advantage of that. You know, if we don't look after ourselves, it's really hard to look after others, and so it's a good reminder this week to focus on that. The big issue, or the big news, I guess, this week from a healthcare point of view, as it relates to COVID, is we all received within the hospital setting a document from the government that looks at a measured approach to planning for the reintroduction of surgeries and procedures within the COVID-19 pandemic. We're not green-lighted to actually start to ramp up, but there is a very clear framework that we are all to use now in working through the steps that will get us to a point where we can introduce services back into the mix. And if you follow the province, they've got a stepped plan on how they're going to be introducing businesses back into the economy, and healthcare is very similar to that. So we've asked Ryan Itterman to sort of take the point on our internal work, but any reintroduction of services will need to be done in a coordinated regional way across the Southwest. So we're going to be working closely with our other hospital partners, with our community partners, and other players in the system as we work on this initiative over the coming weeks. With that, there's a few things we have to look at. And the direction we're being given is that different parts of the province may come online at different times. And it's going to be influenced by a number of things. It's going to be influenced by the community and whether there is COVID-19 within the community where you operate. It'll be influenced by the individual organizations and what their status is and their ability to handle the situation. It's going to be influenced locally and regionally by PPE availability. We know we've been having challenges around PPE, and as we ramp back up and as we introduce services again into the mix, the demand on PPE is going to increase. So we have to keep that in mind. We have to look at medications. There's concerns around access to medications and making sure we have enough in the pipeline to support what we're doing and what we're going to do. So that would need to be a consideration. The bed availability, ICU and critical care, acute beds. We've been told in our planning document that we need to maintain 85% occupancy or have the ability to very quickly get down to that so that we have capacity. So we'll look at that. Health Human Resources, do we have the people to support ramping up? And the expectation provincially is that within that we continue to support congregate care settings as appropriate. And then we have to look at the pre-op, the post-op, the post-acute, all of those pieces. So we'll be creating a plan. It'll be part of a broader regional plan, and then we will have to get sign-off once the province is ready to green light us to go. So it's a good news story. On one hand, we are coming through this. We think we're going to be able to reintroduce, but we have to do it in a very thoughtful way. You may have seen the analogy recently around parachuting and taking the sort of the foot off the pedal when it comes to being smart about physical distancing, etc. There's a lot of people who are probably saying, look, the numbers aren't what we thought. Let's just get back to normal. And I think that would be a mistake. It's like parachuting. You open the parachute, it slows you right down. You don't take the parachute off until you touch ground. And that's really what we need to do with the COVID situation. Be mindful of it. Do what is smart. Ramp up services as we can, but be ready. There will likely be other spikes that we have to deal with, and we will do that. So that's a good news story, but we'll do it in a very planned way. I want to give a real shout out to a few of our team. We recently put out the Donnelly Tour-Hodes Nursing Recognition Award for Exceptional Care. And if you're following our social media, you'll see we had 8 nominees for that. So I just want to give them a shout out. Rebecca and Pam, Josie, Jody Lynn, Janine, Grace, Debbie, and Ann. So congratulations on being nominated. And I often think, obviously someone will receive the Donnelly Award, but sometimes I think being nominated by your peers is even more special. I think that, and so kudos to you for that. And sort of on the same line, as you know, we had Patient Experience Week last week, and we had the Candygram program. There were almost 700 Candygrams prepared, and those are shout-outs to our colleagues and our co-workers. And I think we would all agree that our culture as an organization is defined by all of us, and working with great people in this organization is one of the things that makes it such a special place to work. So as I finish this video, I'm not sure if it's shorter or longer than usual. Shorter, okay, that's good. Don't want you to really become too jealous watching this with the Senator's jersey. I want to read a letter that I got today, and it's from, I'll read the letter. It's on lined paper, number 1. Dear healthcare workers, thank you for helping us during this hard time. It is very hard to go through this sickness. I hope it is over soon so we can be over with being at home and we can go to parks. But when this is over, we can go to parks and stores. Thank you very much. I'm 10 years old and I'm in grade 4 this year. Sincerely, Maggie Wall. Everything we're doing in our healthcare system, in our community, is for Maggie and the Maggies of this world and Maggie's parents, grandparents, friends, and loved ones. So keep up the fantastic work. Thank you.